This is Chapter 34, Care of the Patient with Disorders of the Urinary System. So there are a couple of types of UTIs, or urinary tract infections, also called UTIs. You have cystitis and urethritis. So cystitis is actually inflammation of the bladder. So the infection is actually in the bladder. And so the most common type of urinary tract infection is E. coli, like I stated in the previous presentation on Chapter 33. E. coli is found in the stool, and so when you have stool that gets in the urethra and travels up the urethra, then you can have infection develop that way. And so when we're talking about cystitis, that's an infection actually in the bladder itself. So another thing, when we talked about older adults in Chapter 33, but remember we said that the muscle tone in the bladder can decrease, and so when that muscle tone decreases, it prevents the bladder from emptying like it needs to empty. So when urine just sitting in the bladder, the urine's not being emptied and it's just sitting in the bladder, that allows that bacteria to continue to grow, which puts individuals at risk for urinary tract infections. Also, we discussed estrogen in older adults. When we talk about our older adult women, the estrogen decreasing and causes atrophy of the bladder wall or the tissues, and urinary dysfunctions, making these individuals prone to urinary tract infections. And then remember we talked about older adults purposefully limiting their fluid intake so that either A, they don't have to go to the restroom so frequently, or B, to prevent them from being incontinent. And so they purposefully limit their fluid intake, which puts them at risk for urinary tract infections, because they're not flushing out their systems, their renal systems, like they need to. Another thing, when we talk about fluid restriction, some of our actual disease processes causes individuals to have to be on a fluid restriction. And so those individuals that are on fluid restrictions, same thing, they're not able to flush their renal systems out, and so putting them at risk for urinary tract infections. Some of those diseases that you might be on fluid restrictions for could be congestive heart failure or renal failure, are some of those things that might cause you to have to be on a fluid restriction. All right, so we talked about some of these signs and symptoms when we're assessing our patients, things that we're going to find out as far as signs and symptoms of cystitis. They might have painful urination, so it might be painful when they urinate. Frequency and urgency, going a lot, urgency, it gotta go, can't hold it type thing. Low back pain, that's that flank pain that we had talked about. Maybe your patients might have that when they have cystitis. Urinary meatus may be swollen or painful. Urinary meatus is the point at which the urine actually exits the body, the area where the urine exits the body. The urine might be cloudy, or it might be bloody, or it might be foul smelling. All these could be signs and symptoms of a bladder infection. So when you have, and remember we talked about our older adults might not have the same symptoms, signs and symptoms as a younger adult. So our older adults might have some confusion. Even if they have dementia, there still might be something different in their mental status when we talk about confusion. So even those dementia patients, you still might see something different in their mental status that might indicate that they have a urinary tract infection. If you have an individual that has frequent urinary tract infections, they might have be fatigued or anorexic, meaning that they are not wanting to eat or anything like that. Okay, so to treat the cystitis, of course, the antibiotics, and like I said, that culture and sensitivity is going to tell you what antibiotic the bacteria is sensitive to. So it would be important to have that culture and sensitivity so that the doctor would know what type of antibiotic to order. The pyridium to relieve discomfort. And so the pyridium, one thing you want to make note of with that, is going to turn the urine an orange color. So if you suspect, if you would want to tell your patient if they suspect that they have a UTI, they would want to, before they take that, they would probably want to have their urine tested first, because that pyridium is going to turn their urine orange. So that's suspected, so not to be alarmed if you note that. Make sure your patients know that. Postmenopausal women, so since they have a decrease in estrogen level, they might benefit from some estrogen as well. Drinking plenty of fluids to flush that bladder out, at least 8 to 12 8-ounce glasses, unless they have one of those conditions that contraindicated. So plenty of fluids, drinking plenty of fluids. Cranberry juice helps to alter the pH, or cranberry-based products. So a lot of people take cranberry juice. Some have the cranberry pills actually. And so remember we said a normal pH is 4.5 to 6.0. So it's typically a little on the acidic side, our urine is. And so hot water bottles over the back or the bladder might be helpful, because they might have bladder cramps or spasms or something like that, and so that might be a little bit helpful, with that. Okay, so preventing UTI. So we talked about some of this already. We talked about wiping from front to back, educating women to wipe from front to back after using the restroom, because you don't want the stool, which has the E. coli, to be transferred into the urethra. You want to avoid wearing tight pants, or anything that's going to cause moisture in the perineal area, because that has the potential to, breed bacteria and whatnot, and introducing infection. You don't want to wash your underclothes in strong detergents, and make sure you rinse them appropriately. Don't sit in wet bathing suits or wet clothes for extended periods of time. Again, because you don't want that perineal area to have just moisture just sitting there over long periods of time. Preferably wearing white cotton underwear would be preferable, because again, those silk underwear or other type underwears, they can cause moisture in the perineal area, so you don't want them. Showering would be preferred over bathing, because bathing, you're sitting in the dirt, of course, which can be introduced into the urethral area. So showering is preferred over bathing. And if you when you do bathe, you don't want to use bubble baths or things like that. You don't want to use douches or hygiene sprays or anything like that, because that can change the pH of the normal pH, and we don't want to do that using douches and things like that, changing the pH of the vaginal area. Okay, more things to help prevent urinary tract infections. You don't want to sit for extended periods of times. So prolonged bike riding or horseback riding, those type things, increase your risk for urinary tract infections. Again, drinking plenty of fluids in a day, at least 8 full glasses a day. That helps to flush out the renal system. So you want to drink plenty of fluids. Do not ignore vaginal discharge. You want to, talk to your healthcare provider and get that checked out. Emptying your bladder after sexual intercourse is important, as it's important also because during intercourse you can get bacteria or different things in the urethra. And so if you empty your bladder after intercourse, then the urine can help flush the urethra out and flush any bacteria or germs that might have gotten in the urethra, urinate, and can help to flush that out. So urethritis, this is another type of urinary tract infection, whereas cystitis is a urinary tract infection in the bladder. Urethritis is an inflammation of the urethra. So again, you have infection in the urethra. So that's the difference in the two types of UTIs. Antibiotics will still help, with this as well. You just have to, if you do that culture and sensitivity, it'll tell you which type of antibiotic the bacteria or the infection is sensitive to. So women that have trauma during childbirth can put themselves at risk for urethritis. Also using spermicidal jellies, those bath powders and things like that, hygiene sprays, bubble baths, all those type things can put you at risk for urethritis as well. So some symptoms you might have with urethritis: you might have burning when you urinate, pain or burning when you urinate, itching could be an issue, frequency, so having to frequency, feeling like you got to go all the time, urinary meatus, swollen and inflamed, some of the same symptoms as cystitis as well. Purulent discharge if gonorrhea is present. So purulent means like a pussy type discharge, gonorrhea, if gonorrhea STD is present. And so the treatment is pretty much going to be, what we discussed for the treatment of cystitis as well. So one of the most common renal diseases is acute pyelonephritis. It's a sudden bacterial infection. So it's actually an infection in the kidneys. So you have bacteria that might travel up from the ureter. So remember, from the kidneys, the urine flows down into the ureters, and the ureters take the urine down to the bladder. So if you have some type of kidney stones or something that's causing urinary stasis means that the urine is just sitting there. So if it's just sitting there in the ureters or whatever, remember we said that bacterial growth can occur. So then that bacterial growth starts to grow, and then it can travel up the ureters back to the kidneys and causing infection in the kidneys. And so if once it's treated, the inflammation is fine, it's fine or whatnot. But the problem is with pyelonephritis that the inflammation will subside, but you'll have some scar tissue that stays there. And so if you continue to have pyelonephritis, you continue to have these chronic infections and inflammation, and then it subsides each time, but then you get another one, and then you have scar tissue from that one, and then that one subsides, you have another one, and then you get that one resolved. But each time you're leaving more and more scar tissue. And so then the more scar tissue you leave, if you keep having them and keep having this scar tissue build up, you're going to end up with impaired kidney function at some point if you continue to have this issue. So some signs and symptoms you might notice with this, they might have urgency and frequency as well. They might also have some burning on urination, but they're going to have a fever that's going to be pretty high, probably higher than 103, higher than 102, definitely higher than 103. As a result, they'll have chills, headaches, malaise, which is just like a weakness, nausea and vomiting. They're probably going to have some flank pain that's going to radiate to the thigh and the genitalia. So that's going to be a key indicator there. That flank pain, remember we said lower back area, that is going to radiate to the thigh and genitalia. So remember that. The urine may have blood and pus in it as well. They might have some nocturia when we talked about urinating at night. And when you say blood in the urine, that's called hematuria. So remember that, hematuria. They might have anorexia, which just means they're not wanting to eat and whatnot. And the urine might be cloudy or whatnot as well. So again, the treatment is going to be like we talked about with the treatment that we discussed with cystitis. So, going back to, how we treat the cystitis, giving them plenty of fluids, making sure we're giving them plenty of fluids. Like we said, their fever is going to be up high. So we're going to probably need to give them some antipyretics to get that fever down, maybe some analgesics as well. Bed rest, they're going to need bed rest to decrease the workload. INOs, you're going to want to do INOs on your patients that have these kidney disorders. Monitor any urinary changes that they might have. IV fluids, they might need some IV fluids as well to help flush those kidneys out. So and you want to do things that's going to prevent reoccurrence, because like I said, if you continue to have these infections of the kidney, then eventually you're going to have that buildup of scar tissue, and it's going to cause impaired kidney function. Acute glomerulonephritis occurs when the nephrons in the kidney, primarily the glomerulus, become inflamed. So the glomerulus is involved in filtering the blood to form the urine. So remember we said the kidneys help to filter all that fluid that comes through to form and eliminate the waste. So in glomerulonephritis, the glomeruli become inflamed, and it can occur as an acute primary reaction, or it can be secondary to some other systemic disease. The most common form of glomerulonephritis occurs as a primary reaction about a couple weeks after you might have strep throat or some type of skin infection or something like that. Although it generally affects children between the ages of 6 and 10, adults of any age may develop glomerulonephritis, acute glomerulonephritis, after having strep throat. Other things that can cause it are bacterial, viral, or some type of parasitic infection that occurs somewhere else in the body. So signs and symptoms you might notice with glomerulonephritis are fever, chills, flank pain. So you got this edema and puffiness and hypertension, which is a late manifestations. But think about what's happening here. If the fluid and blood is not being filtered through the kidneys, then it has to be backing up in the body. So if it's backing up in the body, it's going to cause edema, the puffiness under the eyes, the visual disturbances, and things like that. And late manifestation would be high blood pressure because the fluid in the body is building up. Other signs and symptoms of glomerulonephritis are hematuria. Remember we said is blood in the urine. So hematuria. So if your urine might be like a Coca-Cola color as well. Red blood cells. You might have red blood cells in the urine as well. Proteinuria, which is just protein in the urine. Decreased GFR. So GFR is your glomerular filtration rate. The glomerular filtration rate tells you how much blood is being passed through the glomeruli to be filtered. So you want to know how much blood is being filtered in the kidney. So if your glomerular filtration rate is decreased, then your kidney function is also decreasing, because that means the kidneys aren't filtering as much blood as they should be. So if the glomerular filtration rate is decreased, the kidney function is decreased. And then remember in chapter 33, we said if your BUN and creatinine are increased, your kidney function is decreased. So you want to remember these lab values because they give you good key indicators of what your kidney function will be. So an increased BUN and creatinine would be a decreased kidney function, and a decreased GFR would be a decreased kidney function. So remember those things. So how are we going to treat glomerulonephritis? We're going to have a sodium restricted diet if the patient has edema, because remember water follows sodium. So if you're taking in a lot of sodium, then you're going to be increasing your fluid. And if you already have increased fluid with edema and everything, that's going to be an issue. So you want to limit your sodium intake. So knowing foods to teach your patient that are high in sodium. So like processed foods are really high in sodium. Lunch meats are really high in sodium. Canned foods are really high in sodium. So you want to know foods that are high in sodium to be able to teach your patient what foods they should limit. Fluids may be restricted as well if the patient has oliguria and anuria. Oliguria, remember we said oliguria is decreased urine output, anuria is no urine at all. So if they're not putting out any water, you don't want to putting out any fluid, you don't or urine rather, you don't want to keep adding fluid and just build into the fluid that's that they're retaining. Low protein diet, because these individuals the kidneys aren't filtering anything, right? They're not filtering anything. So we want a low protein diet because we don't want that to build up. Plasmapheresis, that's just a technique that's used to help clean the blood, and so that might be something that's necessary for the patient. So you want to make sure you provide supportive care to your patient. Focus on continuing to observe that patient. You want to monitor their vital signs. Obviously monitor their INOs because we want to make sure that their urine output starts to be where it needs to be. Monitor daily weight to make sure they're not continuing to retain fluid. And so when we monitor the weight, we want to do at the same time, typically in the morning after they urinate, before they eat, wearing roughly the same amount of clothes. You want to observe for signs of fluid, electrolyte, and acid-base imbalances as well. consult the dietitian to plan a low sodium diet. You want a low sodium diet. Administer medications as ordered, any medications the patient may have. You want to observe the patient for any restlessness or respiratory difficulty, to determine, is this fluid increase, is it affecting their respiratory status, their cardiac function, their mental status. These are ways we can determine if the fluid, is to continuing to build up. You want your patient on bed rest to decrease the workload of the kidney. Put them on bed rest, at least until the hematuria has stopped and the hypertension is gone as well. Hydronephrosis, this is when you have some type of an obstruction, such as like a kidney stone or something that's obstructing the normal flow of urine. So as a result, the ureters, or the renal pelvis, is where the kidneys are. So they're filling up with urine as a result, and they begin to dilate because they're filling up with urine. And so eventually the kidney function is going to stop if you don't get this under control. And so what'll happen, you have this compensatory hypertrophy. And so compensatory hypertrophy is, so say you have one side, say your left side, your left ureter and kidney is affected, then the other kidney will enlarge and take on the workload of both kidneys. That's what that compensatory hypertrophy, compensatory meaning compensate, and hypertrophy it means enlarge or whatnot. And so the other kidney enlarges to and takes on the workload of for both kidneys. So the main symptom with this is pain, severe pain with the hydronephrosis, and it's going to develop pretty quickly. And so it's important to go ahead and get this resolved. Like I said, if you don't get it resolved quickly, then kidney function is going to stop. And so once damage occurs to the kidneys, then that's when you run into kidney failure. So a couple different things to treat this. One way is obviously get in there, remove the obstruction. So if you remove the obstruction so that the urine can flow properly. Or a nephrostomy. A nephrostomy is when a surgical incision is made into the kidney and help, to drain the urine out that way. This would be the early stages. If you've got so much damage that the kidney just can't be repaired, then a nephrectomy might be in order. And a nephrectomy is just removal of the kidney itself. So if your patient had to have surgery for hydronephrosis, then obviously you want to, if they have any catheters or tubes or anything in place, you want to monitor those and, make sure those are flowing appropriately. No kinks or anything like that. You want to monitor your patient's vital signs. They might have some a blood tinge on their dressing, but it shouldn't be bright red or anything like that. If it's bright red, or you notice any changes in the amount, you're starting to get a large amount and a significant amount more than what you were seeing, you want to make sure you notify the surgeon right away. Monitor their urine output, of course, and the fluids might be restricted at this point as well, because you need to ensure the kidneys are functioning, properly before they're put back on a normal fluid Okay, so stenosis is when the renal artery is actually blocked or narrowed for some reason because of atherosclerosis, or some scarring is blocking the flow of blood in the renal artery. And so, of course, this can cause hypertension, which is high blood pressure, or chronic renal failure. And so you want to monitor your patient's blood pressure as well, to make sure their blood pressure is not going up. And so the way we're going to treat this is a balloon angioplasty, where you actually go in and open up that artery so that the blood can flow through, or put a stent in, or whatnot, to improve blood flow to the kidneys. Because just like when we talked about, some of our other diseases, when we have a decrease in the blood flow to a certain area, what's going to happen? You're going to have a decrease in oxygen to that area. So if you have a decrease in oxygen to that area, then that area will will eventually die or whatnot. And so we'll have chronic renal failure if we don't get blood flowing, or high blood pressure if the blood's not able to flow through properly. So renal stones are a solid mass that's made of crystals, and so they could be varying sizes. So depending on the size and the location, it could obstruct the flow of urine. So if you had a small one, somewhere, they can actually develop anywhere in the urinary tract. So if you had one in the ureter, and a fairly large one in the ureter, obviously it's gonna block the flow of urine on that ureter. If you had a small one somewhere, along the urinary path or tract, it might not necessarily block the flow of urine. So it would just depend on the size and location of it as to whether it would block the flow of urine. So a lot of different things can cause these stones. You can have decreased urine production from dehydration, can cause it. An infection can result in damaged tissue. If you have consistently acidic or alkaline urine. Urinary stasis, so stasis being that the urine is not moving through. Increased intake of calcium or oxalate-rich foods. And so the calcium oxalate-rich foods, so that's like an increased intake in your protein, sodium, inadequate fluid intake, and prolonged immobility can cause that. It can come from a lot of different things. It can actually be hereditary as well, that you just inherit this and get this quite a bit. When we talk about that uric acid buildup, so excessive dietary purine, so that's like in your organ meats, your gravies, your red wines, your sardines, things like that. So all these different type things can be a result or cause different types of kidney stones or renal stones. So to prevent the stones, if you're at risk for renal stones, you want to increase above what we said, your average person would be drinking to flush those kidneys every 24 hours. You're going to increase your fluid intake, water intake, to 3,500 mLs every 24 hours. You want to do all those things we talked about to prevent urinary infections. Make sure you maintain urinary drainage. So when you got to urinate, go ahead and urinate. Ascorbic acid and dietary modification. So remember we said cranberry juice was good to help with the pH in the urine. So cranberry juice, prunes, lemon juice, all those can be used to help acidify the urine as well. to help prevent those stones from forming. So signs and symptoms. So like again, it depends on the size of it. So if the stone is small enough, it may just pass right on through the urinary tract and you not even know it. And you pass the urine, when you urinate or something, and you may not even know it if it's small enough. If it's on the larger size, if it's larger, then when it moves through the urinary tract, so when it's going through the urethra or whatnot, whatever area it's moving through, if it's large enough, it can cause pain and bleeding when it moves, or cause swelling, or it can get obstructed. And then if it gets obstructed, then we have all those other issues with the urine backing up and not being able to flow through. So then we get the infections and things, all those other things that we talked about, if it actually blocks the urine from passing. Person could have nausea and vomiting as well. So again, it just depends on the size of the stone as to what signs and symptoms you might experience. So, again, depending on the size and what's going on with that stone, we might be able to flush it out by increasing the IV fluids and increasing your oral intake. So we might be able to, flush it out that way. You may need some pain medications if it's, to the point that it's causing you pain. You may need some pain medications or some antispasmodics, depending on, if it's causing you some issues. We might be able to use a stent to open the ureter or wherever it is, open that area up so that the stone can pass through effectively. Extracorporeal shock wave lithotripsy. So that's where you're placed in this a water bath, and then shock waves are sent through to try to break up the stone that way. Nephrolithotomy. So that's an incision where they would put an incision in the kidney to try to remove the stone that way. Pyelonephrolistherectomy. And so that's removing the stone going through the renal pelvis area is another way to try to get that stone out of there. So again, it just depends on where it is, how large is it, are you able to, if you're able to pass it effectively, without any of these extra interventions. Obviously, if they're going to try to go the least non-invasive route, if possible. So if we're trying to have you pass that stone, spontaneously just through your urine, we're going to encourage fluid intakes to try to, flush it out. And then all the urine's going to be strained so that we can determine, when that stone has passed, recover the stone or whatever the fragments are that might come out once it's actually passed through. So your urine will be strained, but definitely lots and lots of fluids to try to help you pass it. Okay, so acute renal failure is the sudden cessation or stopping of renal function. And so acute renal failure is reversible if we're talking acute renal failure. And so it occurs one of three types: pre-renal, intrarenal, or post-renal. So pre-renal occurs when you have a decreased blood flow. So you have poor perfusion or poor blood perfusion, and it causes the kidneys to stop functioning suddenly. So something caused a decrease in blood flow, which caused the kidneys to stop functioning. Intrarenal acute renal failure. With intrarenal acute renal failure, That refers to damaged cells within the kidney. So like when you get glomerular damage or tubular necrosis, that's caused by ischemia. So ischemia is when there's a lack of oxygen going to that particular area. And then post-renal acute renal failure occurs when the kidneys stop functioning because of an obstruction within the actual urinary collecting system. So some type of obstruction in the ureters, the bladder, or the urethra would be post-renal acute renal failure. So this picture is actually in your book, and it kind of breaks it down for you what types of things would cause pre-renal versus intrarenal versus post-renal acute renal failure. So like I said, things that's going to decrease the blood flow to that area. So you got CHF, shock, sepsis, those type things, and they'll decrease blood flow. Intrarenal, so things like nephritis, nephrotoxins, acute glomerulonephritis, like we talked about, those kind of things can cause intrarenal. Post-renal, anything that's causing an obstruction in the ureters, the urethra, or whatnot, the bladder or whatnot. So you got that obstruction. And then it also shows you what happens with chronic renal failure as well. So once you develop this acute renal failure, you can see how the flow goes. You get tissue damage, which is going to decrease your glomerular filtration rate. And remember, we said the glomeruli are what actually helps to filter the blood that's going through the kidneys. And so if the glomerular filtration rate is decreased, then it's not filtering the blood like it should. And so so then you're going to have decreased tubular function, decreased hormone secretion, which is going to lead to all these imbalances with the potassium, the sodium, the hydrogen, and all those things. So since the kidneys are not filtering the blood like it should, you're going to notice changes in your urine output. So for example, you might have proteinuria. Remember I said if you see that word, that urea at the end, you know it has something to do with urea. So proteinuria, protein in the urine. You're going to see electrolyte imbalances. So hyponatremia, hyperkalemia, hypocalcemia, all those type things. Fluid imbalances. So different things going on with your blood pressure. If the fluid's backing up, you're going into the body, you're going to start to see edema in the extremities, pulmonary edema, so fluid buildup in the lungs as well. Acid-base imbalances, metabolic acidosis is what you're going to see when you have renal failure. And you'll learn more about those acid-base imbalances once we get to that chapter with fluid and electrolytes. GI problems, you're going to notice nausea, vomiting, anorexia, meaning they're not able to or not wanting to eat. Mental status changes as well because the fluid's backing up. So lethargy, memory impairment, anemia, and platelet dysfunction. So you will see fatigue and bleeding and bruising easily. Impaired wound healing. All these are going to be some signs and symptoms you'll notice in your patient with renal failure. So remember, we said acute renal failure was reversible. So we want to correct whatever the underlying cause is. So if it's a obstruction in the ureters or whatnot, correct that, or whatever the underlying cause is, we want to correct that. Remember, we said there was could be some fluid and electrolyte imbalances, so we want to correct those issues. patients may have anemia and hypertension, so they probably would be getting medication to help with those issues. Cleansing the blood, so hemodialysis or peritoneal dialysis. You've seen your patients with hemodialysis or whatnot. And so remember, we're going to feel a thrill and hear a bruit. So remember, your patients with their dialysis ports will have those. But peritoneal dialysis is another type dialysis that patients might use. And so that's filtering the blood across the peritoneal membrane. Is another way that individuals can have dialysis. So as nurses, we're going to monitor for signs for fluid imbalance. And so that's going to be, we're going to be monitoring the patient's edema, making sure they're not retaining fluid, monitoring their daily weights, like we said before, first thing in the morning, before they eat, after they urinate, same amount of clothing. Monitor their lung sounds, because remember we said these individuals could have pulmonary edema as a result of the backup of the fluid. So we want to make sure we're monitoring their lung sounds to ensure that that's not happening. Strict I&Os, make sure, you know, they're not retaining fluid as well. Monitor their mental status changes. Are they having cardiac dysrhythmias? All these could be indications fluid continuing to build up. If they're nauseous, remove any stimuli or things that would be making them nauseous. Do they need assistance with their ADLs? Let's help with that. We also want to monitor for any signs and symptoms of infections that they might be having. So chronic renal failure, this is going to be, unlike acute renal failure, chronic renal failure is going to not be reversible. So it's going to be irreversible. And so this is occurs over time, months or years. And so you're going to notice these patients are going to have an increased BUN. So remember, we said increased BUN meant low, decreased kidney function. They might have nocturia. Remember, we said nocturia was urinating at night. Inability of the kidneys to concentrate the urine, causing polyuria or very dilute urine. Headaches, fatigue a lot. Dry skin, scaly skin, yellowish, gray. Pruritus. Pruritus means itching. So all those things you might see in your patient with chronic renal failure. And these are just some other symptoms you might see in your patient with chronic renal failure. So hypocalcemia, and you remember all the things we talked about when we discussed hypocalcemia, the twitching, muscle cramps and things like that. Hypertension, if they have fluid overload. Remember we said if the circulating fluid in the body increases, the blood pressure is going to increase. And so again, if the fluid in the body is increasing, the weight is going to increase. So you might see increased weight. Hypertension, pulmonary edema, and heart failure can also result if the fluid is backing up. Anemia, anorexia, which means not eating, nausea, vomiting, constipation from drugs that they may be taking, medications they may be taking, and restless leg syndrome also might be something we see in these patients.